This episode is brought to you by Banfield Pet Hospital and proudly sponsored by our friends at Zoetis, whose range of pet medicines, treatments, and diagnostics are designed to help you and your vet actively prevent diseases, manage skin conditions, treat infections, reduce pain, minimize anxiety, and more.
Your call has been forwarded to an automatic voice message system.
Hannah Shot.
Is not available. At the tone, please record your message.
Hi Hannah, this is Alex from Austin. My dog Cooper is getting older, and lately I've noticed he's a bit stiff getting up in the mornings. He still wants to go on walks, but he seems slower and not as playful. Could this be arthritis? And if so, what can I do now to help him feel better and stay active?
Aging can bring a lot of changes, but not all of them are inevitable. Sometimes what we think is just getting older is actually a medical issue that we can treat, and arthritis is a big one. As a person with a cat who was recently diagnosed with arthritis, I know how subtle the signs can be at first, and how much things can start to improve when we take action. So that's what we're talking about today: arthritis in cats and dogs, what it looks like, how to spot it early, and the practical ways that we can support them so they stay comfortable and active. Today, I'm chatting with Dr. Erica Pounds, Senior Program Manager of Veterinary Development at Banfield Pet Hospital in Tennessee. She's a veterinarian who is deeply passionate about professional development and creating opportunities for growth and leadership within her teams. Okay, Dr. Pounds, welcome to the show.
Thank you so much, Hannah. I'm really excited to be able to be here with you this morning and very excited about what we're going to chat about today.
Me too. Before we dive into our subject, I'd love to just get to know you a little bit. Can you talk to me about what drew you to veterinary medicine?
If you ask most veterinarians, right, we knew from very early age that that was the career path that we were going to follow. And so my story is very similar. I can remember, all the way back to kindergarten saying that I wanted to be a veterinarian. I just followed that path all the way through school and college and whatnot. And so I graduated from the University of Tennessee in 2011, and then I joined Banfield. And so actually, August of this year, I celebrated 14 years with the practice.
I've heard that you're passionate about team based care. Can you talk about what that means?
It is thinking about the entire team from your veterinarian, who, of course, is seeing and directing and delivering the care for our patients. And then it's the team that is surrounding them, helping to enable them to be able to do that for the pets that need to come and see us. So it starts with our service coordinators at our front desk, to our veterinary assistants, to our veterinary technicians, and to the doctors on our team. And it's really thinking about how do we as a team really celebrate and foster everyone's skill sets and their passions and their strengths coming together as a team to be able to deliver care to our patients and educate our clients as a cohesive team unit.
I love that. I also read that you are a quilter. Is there any overlap between the quilting work you do and the veterinary work that you do?
It really does kind of go hand in hand, right? I have been quilting now for years. When we think about putting together a quilt, right, you have all of these different fabrics and patterns and shapes and textures and things that you're putting together to build this beautiful quilt that comes together in all of its, glory at the end. And when we think about our teams, it's very similar. We're coming from different backgrounds. We have different strengths and skill sets and passions. But when I was a hospital leader and a market leader, right, it was thinking about how do we bring those strengths and skill sets together to really create this beautiful framework of a team as a unit together. So, yeah, there's definitely overlap there for sure.
Okay, so today we are talking about arthritis in dogs and cats, which is something that I'm very interested in because actually my senior cat, Haroon, was diagnosed with osteoarthritis this year. So I have a lot of questions for you that I'm hoping to learn today. I want to ask you to start by just kind of defining arthritis. What is it? What does it look like?
Yeah, so arthritis or osteoarthritis it's a progressive condition where you're seeing changes within the joint. And so we're seeing changes within the cartilage, we're seeing changes sometimes within the consistency and the lubricating effect of the joint fluid within the joint too. We start to see some changes within the mobility. So whereas your pet might in the, morning jump right out of bed, go over to their, food bowl to be able to eat, now maybe you see that they are a little slower to get up and they're a little bit stiff when we're kind of first getting moving. They warm out of it and start to kind of walk about normally, but at first it just takes a moment. So there are some things that oftentimes our pet owners will pick up on that they're seeing at home that then they're able to share with us when they come into the clinic. So it starts to give us an indication of, hey, let's dig a little bit deeper here and kind of see what's going on. As I mentioned, it's a chronic and progressive disease. So in and of the fact that when we diagnose a patient with osteoarthritis, it's not something that we're able to cure. We're not going to make it go all the way away, right? But what we can do is we can put together a great treatment plan, thinking of how do we help to manage this process.
Can you talk about kind of what is causing this to happen in the body?
Yeah, so it's very multifactorial. So certainly sometimes there is the leaning of some genetic predispositions. So there are certain breeds that may have a predisposition to developing osteoarthritis later on in life. We can think about things just like you would in human medicine. Perhaps if they've had an injury, so they've had some type of change within that joint is not what it always was. And so we can start to see arthritic change happen within that joint post injury. We can see other conditions sometimes contribute to that as well. So if you think about our pets that are overweight or have a super high body condition score, that's putting additional stress and strain on those joints with that extra weight that that patient is carrying. So sometimes, again, that can be a contributory factor. If there's other things that are already happening within the joint, then that additional stress can sometimes just exacerbate that a bit more. So, not just one single answer for that question, definitely very much individualized based on that patient, how they're presenting, what's going on with their life as far as what started kind of that process in their joints.
And I think when some people see that their cat or their dog is seeming a little bit more stiff, they might attribute that just to normal aging. So, how do you distinguish the difference between stiffness that is normal or part of aging and stiffness that is a red flag for osteoarthritis?
Yeah, so great question. It's all going to start right with the conversation with the owner, right? Trying to get an indication of exactly what are they seeing with their pet. Oftentimes, if I, were to see that I had a potential, lameness or mobility issue kind of on my appointment log for the day, I might, just reach out to the client, say, hey, if you had any videos of what you're seeing at home, would you bring those along? Because oftentimes what will happen is when they come into the clinic, I would tell owners this all the time, that sometimes our pets will try to be brave and they'll try to mask the lameness. And so I'll be like, just because I'm not seeing it does not mean that it's not there. Right. And so sometimes those videos from home can be really helpful. So starting with that conversation, understanding what's going on, what is the owner seeing, what are their primary concerns. And then we go into, right, our physical examination and we do a little bit more of a thorough orthopedic examination to be able to figure out, can I isolate this to a particular joint? Can I isolate this to a particular leg? What area of the body is being affected here? And then that will help to really start putting the pieces of the puzzle together. I want to be able to see what's going on in the joint, as there are some hallmark characteristics when we take a look at the joint on x ray that help us to go, okay, we have some osteoarthritis going on within that joint. I don't see anything else that is going on, right? We've been able to exclude any other diagnoses. here's where we are, and now let's make that path forward to figure out what are we going to do for treatment, and to be able to help keep them comfortable, and so they can continue to do what they love to do.
It's a great tip about the videos because that's exactly what happened for me. Actually, the way that our cat was diagnosed was I was on FaceTime with my friend who is a veterinarian, and she saw my cat in the background and she said, "Hang on, put the video on Haroon." And it was such a subtle change that I am embarrassed to say I hadn't noticed because I look at him every day. He's 14 years old. I had not noticed, and she said, he's walking more stiffly. I said, "No, is he? No." Like, I think sometimes we we're in denial that our animals are getting older or that changes are happening. If it were not for her seeing that video of him, I don't know that I would have noticed as early as I did. So, for people who are listening to this and going, "Oh gosh, should I be, paying closer attention to my dog or my cat?" What are the other than walking, what are some of the activities that they do that you might want to start taking video of or starting to pay extra attention to? And is it different for cats and dogs?
Cats can be tricky. And Hannah, I know as a cat lover, you know this, they are notorious for trying to sometimes hide and mask their pain. They don't want us to know that anything is wrong. And so sometimes with cats, it can be very tricky. And sometimes we don't catch it until a bit later because there are subtle changes. Look for if they like to climb in their cat tree, if they like to get on the couch to be able to come and snuggle with you. Are they able to do that with the same ease that they used to? Or are you potentially seeing that stutter jump? And that, kind of hesitation to be able to jump up, onto the couch with you. And if so, that could definitely be an indicator of, hey, let's take a little bit closer look at our joints. Let's do a good orthopedic exam on them to check in and make sure that everything's going okay.
You've mentioned weight a couple of times. Can you talk a bit about the role that weight plays in cats and dogs with arthritis?
If we have a patient that is overweight or broaching into that, kind of obese body condition score, what we then know is that that additional weight is putting additional strain onto those joints, right? They were never intended to carry that much weight, and now they are. So, if you have already a process going on within a joint, so you have some evidence of arthritis, that additional weight is just putting more stress and strain on those joints. And so we can see that there become mobility issues secondary to just that additional strain of that weight on them. So, one of the things that we often talk about first as we diagnose arthritis is we're already looking at their body condition score already when they're coming in just for their regular exams. But we're going to take a little bit of a deeper dive and we're going to talk about how do we, number one, maintain an ideal body condition score if they're already there? Or number two, how do we get them to an ideal body condition score? Because we know that that will help to alleviate some pressure and strain on those joints if we can get them there.
Interesting. So, seems like weight is one of those things that you actually can start to think about even before they're a senior animal. Like, even as a puppy or a kitten, you can start thinking about their future. Are there other things that people can do when their animals are younger, or like how young is too young to be thinking about preventing arthritis?
So making sure that when they're puppies and kittens, right, that they are on a good diet that is going to provide them nutritionally what they need for their growing bones and their growing joints, right? And that is going to look different than when they do become skeletally mature. So meaning their bones have grown to their fully matured state. Right. Then we're going to talk about, okay, now what does this look like as an adult? What are those things that we want to have nutritionally, so that it is supporting joint health, and helping to support and maintain a healthy weight for them. We'll talk about things such as omega 3 fatty acids. Later on, we might talk about joint supplements. things that are just there to help promote a healthy joint environment, making sure that that joint fluid and the environment within the joint is as healthy as it can be from what we can help to provide.
Let's switch gears and talk about treatment. Once arthritis is diagnosed, what does a typical care plan look like? And is it different for dogs and cats?
When we think about maybe where is it in the process that we have diagnosed arthritis, what does their symptoms look like? What does their weight look like? What is their exercise level? All of these different things we're taking in as the veterinarian to help us be able to provide that individualized, customized treatment plan to your pet. And so I'll just kind of talk about kind of the big buckets of the different components of a treatment plan. And so after it's diagnosed, and again, as a reminder, that's going to be through physical examination, orthopedic examination, and then diagnosis on radiographs. Then we can start talking about what does treatment look like. And so there's a couple of different components. We've talked about nutrition a lot. And again, nutrition's number one. That's what we're going to discuss with weight management for both dogs and cats. And then we'll start talking about like what are some of those things like omega-3 fatty acids or joint supplements that we might go ahead and incorporate in there. Omega-3 fatty acids have a natural anti-inflammatory component that can help with any inflammation within the joint. Omega-3 fatty acids are also great for every other system in the body as well. So it's not just for joints, it can help across the board. And then joint supplements too. There are specific veterinary joint supplements that you can talk with your veterinarian about that what they would recommend to make sure that it's able to help do the effect that is needed there. And then we start to look into if we are seeing, that maybe it's a little bit further progressed, we're seeing some pain, discomfort, and whatnot. Then we talk about some pain medication options. So things like nonsteroidal anti-inflammatories. There are newer treatments that have come out within the past several years that are actually targeted at a specific pain receptor to be able to alleviate the pain associated with arthritis by being very targeted in its approach. And then the exercise regimen. So when we're looking at nutrition and diet, our medications, and then our exercise regimen. And that exercise is going to be important again because we want to make sure that we're not seeing muscle atrophy, that they're not just becoming sedentary, but also taking in mind what are those consistent, maybe short routine exercises that we can do so that it's not overdoing it to where we see that our patients are then really uncomfortable post exercise, but it's enough to keep those muscles engaged and keeping them active. Yes.
When it comes to supplements, there's a million different things on the market. There's so much information out there. And I know from personal experience looking into it, it's like it can feel very overwhelming to know what's good, what's not good. What would you recommend to people when they are considering supplements for their cat or dog?
Partner with your veterinarian to talk about what those different options are. And again, based on your pet and where they are within that process and lifestyle, and do they like a soft treat? Do they like a crunchy treat? All of these kinds of things, they can help to provide those recommendations that will work best for you.
Other than weight management, are there components of food when you're choosing a diet that could be more appropriate for a cat or dog who is already at this stage of being diagnosed with arthritis?
Yeah, so there are some great therapeutic diets that are able to be recommended and prescribed by your veterinarian that are actually designed for joint health and for patients that, do have joint conditions like arthritis. There are even some diets that take into consideration. We know that a lot of our patients that do get diagnosed with osteoarthritis also are overweight. And so sometimes there are some therapeutic diet recommendations where it actually combines both of those things together.
So magical to see like how many options there are in veterinary medicine for managing this care. Now, one thing that we were recommended was a monthly injection for our cat, which we've been doing. Can you talk about some of those types of options, and does something similar exist for dogs?
Yes, something similar does exist for dogs, and so that is, when we were sharing earlier that we've seen some new treatment options come available to us within the past several years. Those monthly injections to help with pain associated with osteoarthritis. There is a monthly injection available for cats as well as a monthly injection available for dogs. And what that is really doing is working at the receptor kind of point of how the body is interpreting right that pain sensation, and so it's helping to alleviate pain in that method and in that way. Um, we've been able to see really great success, and you can read stories of how it's been. Um, Almost life changing for some of these patients because they were, very uncomfortable. And then when they started receiving this, the owners were able to see their pets having significant improvements within their mobility and comfort overall.
Yeah, and you've mentioned that arthritis is a chronic condition. So, as we're talking about these things like, monthly considerations and dietary considerations, and I can just hear my own inner thoughts, but also I can hear, people I imagine feel very overwhelmed by the idea of doing this long term and might be concerned about the cost of care. What would you say to someone who's feeling nervous about, the cost and just the act of needing to do this kind of ongoing care?
Absolutely. Those feelings are very valid, and very much something that we probably all feel at some point or time. If you have a pet that has been diagnosed with any condition, right? It
Sure.
can be overwhelming. But then,
Yeah.
certainly, when we are talking about those chronic cases that do have longer term management, I think my best advice is number one, ask questions. Your veterinarian is there to help support you and help to provide that education so that you can help to make the best, most informed decision for your pet. Also, take it in bite-sized chunks, right? So when we are first diagnosing, it's really important to us as veterinarians to make sure that you have the information that you need, which means that we're going to be comprehensive in our recommendations. But as we're being comprehensive in those recommendations, again, sometimes it can be a lot. So don't hesitate to say, hey, doc, thank you so much for the information. Would it be okay if I kind of got some information I can take home and look over? And when we come in for our follow up in a week, could we maybe take this apart and think about it in, what do I need to do now? What do I need to think about in the next 6 months? What do I need to think about in the next year? Because certainly, it, as we recommend things, it might be that you can do all of the things at once, or it might need to be that we start one step at a time. Again, as you're partnering with your veterinarian and having those conversations, you two together are going to be able to make that best decision for your pet as you align on the goals that you have for their treatment. And so just stay curious, ask questions. We want to be able to make sure that you feel comfortable with the recommendations and the treatment plan that we're going forward with. So if there's ever any question, don't be afraid to ask. That's why we're there. That's why our teams are there to help support you in moving through what you need to do next for your pet and in the least overwhelming way possible. We want to be able to help with that.
I want to ask you about environmental modifications in the home, things that we can do to help our cats and dogs feel more comfortable. In my home, we have little chihuahuas, so we have like steps that go up onto the couch and onto the bed. And I
Hmm.
have noticed that my senior cat is using those more. He's electing to
Yes.
use those rather than to do the big jump. Is that something that
Yes.
you recommend? And what other kind of modifications can people make in their homes to just make their cat or dog more comfortable?
Yeah, that is fantastic. And yes, 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 and yes. Use those little ramps or stair steps when you're coming up onto the couch or to the bed or to a chair that they like. Again, because that just helps them to not have that kind of big force on their joints when they're loading back to then jump forward. And you will see that they will start using it because it's not as uncomfortable to be able to get up to be able to snuggle with their owner. Other considerations that can be done, certainly if you have hardwood or slick floors, you will see that patients with arthritis will get very nervous on slick floors. And the reason why is because number one, they already feel a little unsteady because my joints don't feel exactly how they used to when before a diagnosis. And now I'm on a slippery surface. And so that makes me feel unsteady and I don't know what to do. And so I'm just going to freeze or I'm not going to go into that room, even though the owner that I love is in that room. I'm not going to go in there because I don't want to walk on the linoleum or the hardwood floor. So think about different carpet runners or different mats or rugs that you can put down just to be able to provide them with something to grip.
You have given us such great information. I feel very educated about this topic now. My last question for you really is just if somebody's listening to this and they've absorbed all of this information, but maybe they're feeling overwhelmed, not sure where to start. What is your message to them, and what is like a step that they can take in the right direction today?
I think number one would be just take a deep breath. Right? So you have a pet that you love and you care for, and it can be overwhelming if we're worried that something might be going on with them, and those feelings are valid. So first, just take a deep breath. And the next thing would be to just think about if you don't already have a primary veterinarian that you are able to have that relationship and have that communication with openly, please find one. We have lots of great ones at Banfield and would love to be able to partner with you in that. But, bring up the questions and the conversations, perhaps call and make an appointment and say, hey, I would love to come in. I have some questions and concerns with how my pet, just with their mobility. And I would love to be able to talk with a doctor about what do we need to do kind of going forward. So deep breaths, stay curious, and know that our veterinarians and our veterinary medical teams are here to support you through every step and stage of life with your pet, including when they get diagnosed with arthritis.
Let's wrap things up with a fun segment that we call Quick Pause. This is where I'm going to ask you a couple of quick questions, and you are just going to respond with whatever comes to mind. Are you ready?
Okay, yes, I'm ready.
Okay. What is your go to for stress relief?
Well, we talked about quilting earlier, and so certainly that is a go-to for me if I just need my brain to quiet down. And I know that's going to sound a little bit weird because I'm actively doing something, but because I have to focus so intently on what I'm doing so I don't, kind of cut the wrong length of fabric or stitch something together wrong. I hate having to get out the seam ripper. So I always want to make sure that I'm doing it correctly. What that focus allows me to do is it allows my brain to kind of go quiet. The other method that I do is with my brothers and my husband is we love to do obstacle races, and so that is another way in which I can relieve some stress because I'm out and my body is moving, right? And so you can kind of shake all of that stress or anxiety off, as well as I might come up against an obstacle that I'm like, there is no way that I'm going to be able to clear that wall. But then I do. And so it's just a reminder of like I can do hard things.
Wow, obstacle racing. I have so many questions about that, but we'll have to save that for another time. But that sounds amazing. Okay, next question. If your sewing machine could talk, what would it say about you?
I just trust the process, right? And so sometimes, especially at the very beginning of putting together a quilt, I'm like, I don't see how this is going to come together. But in trusting in the process and just moving forward, it never fails. It comes out as a great, wonderful end product. And I think that that just helps me a lot of times to stay grounded in other areas too. Just trust the process. It's gonna work out.
Okay, last question. What is one small thing that every person could do to give their cat or dog a better life?
The first thing is just go snuggle them, right? So, they love you,
Easy. I'm on it.
you love them, right? Just go snuggle them. It does so much for the human-animal bond, and just I know, right, that there are times when my pets will come and, I may be so busy and I'm just trying to move through the day, but if I'll just take that moment and just connect with them and just be so grateful and thankful that they are mine and I am theirs in that moment. That is certainly one great way to make your pet's life better. And the second would be just again, I talked about it earlier. Is having that veterinarian that is your primary doctor, so that you can talk about the things that you have questions about your pet, that you trust with your pet, so you have that trusted partner in care again at every stage of life that your pet has. We want to be able to be there for you from puppy or kittenhood all of the way until they have silver hairs, right? And so having that relationship so that you can talk about the importance of preventive care for your pet, I think is a fantastic way to take that step in making sure that their life is as full and as healthy as we are able to make it be.
Dr. Pounds, thank you so much for this conversation. It has been a really great one.
Thank you, Hannah. I really appreciate you having me on.
Caring for aging animals can be emotional. It's hard to see them slow down and even harder to know what's normal and what needs support. I hope this conversation has helped you feel more empowered to notice when something is changing that might actually be treatable, and to speak up for your cat or dog so they can maintain their comfort and happiness. With the right care plan, there's so much we can do to help animals feel better in their bodies. Thank you to Dr. Erica Pounds, and thanks to you for listening to Not Just Fluff.